So before I start this lecture, I would ask you learners to please like, share and subscribe to Med Learning and also hit the bell icon so that you will be notified about our future videos. With that said, let's begin our lecture. Hello guys, Shami here with another Med Learning video. So I decided to upload this video into two parts. In the first part, I discussed routes of administration and important definitions pertaining to pharmacokinetics. In this part of the video, I'm going to talk about factors affecting drug absorption. Also, I'm going to talk about bioavailability. I'm going to talk about drug distribution. I'm going to talk about drug metabolism. And finally, I'm going to discuss drug elimination. So I have a few important topics pertaining to this video, and it is the part 2 of pharmacokinetic video lecture. So please enjoy the video and thank you for watching. So when we talk about the factors affecting drug absorption, we have a few important factors that affect how a drug is absorbed within the body, and they are: number one, we have pH, second, we have blood flow to the absorption site, third, we have surface area of the absorption site, fourth, we have contact time with the absorption site, and five, we have expression of P glycoprotein. So I'm going to talk about these different factors in a bit of detail in the next few slides. And if I move to my first slide, I want to talk about basically the pH and how the pH affects the absorption of drug within the body. So basically what pH is that when we give a particular drug to a patient, then most of these drugs are either weak acids or weak bases. And these drugs basically dissociate in the form of ions, and then they are absorbed either via the lining of the stomach or via the lining of the intestine if we give them in some oral form, or if we give them enterally, or even if we do not give them enterally, they might be absorbed via the lining of that particular route that we use to give those drugs. So when we talk about the pH and how it affects the absorption of drug, then if we look at this diagram on the right side of the slide, we can see that it says that at pH 1.5, the drug is being disassociated into two ions. Number one, we have negative ion and then we have positive ion. But the negative ion cannot be absorbed into the stomach lining because the stomach lining basically does not allow the negatively charged ions to get inside the cell. So what happens is that basically the drug can pass through the membrane more readily if it is uncharged. So if a drug is in the form of AH, and these are the molecules essentially that comprise the drug, it can readily pass the lining of the stomach or the lining of the particular organ that it wants to absorb through. So the drug basically needs to be uncharged if it wants to bypass the membrane of the particular organ. And this is at pH 1.5. And if I talk about the weak base, because I said that either a weak base, that is the uncharged protonated, can permeate through membranes HA, or A cannot. So A cannot, but the uncharged HA can. And similarly for a weak base, the uncharged B that can pass through the lining of the intestine, or for that matter any organ, easily. But the charged ion cannot pass through the membrane, because for weak base the uncharged B penetrates through the cell membrane. So what essentially we need to remember is that mostly the drugs that we give to patients are either weak bases or weak acids, and therefore they can easily pass through these membranes and have their therapeutic effects. But if a drug is charged, then it cannot pass through this membrane. And this is basically the ratio between the two forms, which in turn is determined by the pH of the site of absorption and by the strength of the weak base or the acid, and is represented by, so we represent that by a constant which is called the pKa constant. So if we have a particular pH, that is the pH at the intestine is 7.2 and the pH at stomach is 1.5, then that is going to affect how the drug is being absorbed into the particular organ or the particular lining of that organ. So I hope you understand this concept. I want to move to the next factor that affects the absorption, and this is basically the blood flow. And the blood flow is a very important factor when it comes to the absorption of a particular drug. And usually what we see is that the intestines receive much more blood flow as compared to stomach. So absorption from intestine is favored as compared to stomach. So this is essentially what we see when it comes to a particular organ that favors the absorption of drug, and therefore most of the drugs are being absorbed from the intestine, essentially because the intestine has more blood flow as compared to stomach. So if I move to the next slide, the total surface area also affects the absorption of a drug to a particular area. So we see that usually intestines have much more surface area as compared to other organs or other parts of the body. So because they have these villi, these little hair-shaped structures, and they provide a large amount of surface area to intestine, therefore it can absorb as compared to other organs or other areas of the body. So therefore intestine has much more capacity to absorb drugs. Now I will move to the next slide, and I'm going to talk about the next factor, which is the contact time at the absorption site. And if we talk about the contact time at the absorption site, then we know that drug if we give them via enteral route, then they generally move through the GI tract, and they move through the GI tract very quickly. And if a person has for example, a severe diarrhea, then if the medication moves through the drug very quickly, then it might not be absorbed as well. And this is essentially what this means, contact time at the absorption surface. So if I move to the next factor, I'm going to talk about a particular protein which is also called the E-glycoprotein. And this is essentially a transmembranous protein or a transporter protein, which is responsible for transporting various molecules, including drugs, from outside the cells to inside the cells. And what it does is that basically these type of tissues are present throughout the body, obviously, and they also including liver, kidneys, placenta, intestine and brain capillaries, and they are involved in the again transportation of drugs from the tissues to the blood. So these type of glycoproteins are again transmembranous transporter proteins, and they are responsible for transporting various molecules, including drugs, across the cell membranes. And they are present in different parts of the body, throughout the body, like liver, kidneys, placenta, intestine and brain capillaries. And they are very important when it comes to absorption of drugs from the absorption site. So if I move to the next slide, now I'm going to talk a little bit about the concept of bioavailability. What is bioavailability? So bioavailability is basically the rate and extent to which a administered drug reaches the systemic circulation. So it means that, for example, I give 100 milligram of a drug and it is administered orally, and only 70 milligram of that drug is absorbed by the body, then the bioavailability of that drug would be 70%. So if I talk about some of the factors that affect bioavailability, then they might be the first pass hepatic metabolism, and this is a very important concept to understand. It basically means that when a drug is absorbed from the GI tract, it first enters the portal circulation, and this is essentially the circulation within the liver, or basically the circulation within the hepatic cells. Hepatic cells are basically the liver cells, and it enters the portal circulation before entering the systemic circulation, and it is metabolized there rapidly. That is, the drugs are first metabolized rapidly within the liver, and this is essentially what the first pass effect is, that before a drug enters into the systemic circulation, it first has to go through the portal circulation, and there it is metabolized, and this is called the first pass metabolism or the first pass effect. So this is true for majority of the drugs, and also for the drugs which we give via orally, and also common for drugs which are given via the enteral route. So if I move to the next slide, I'm going to talk a little bit about the drug distribution concept. So what is drug distribution? Drug distribution is basically the process by which the drug reversibly leaves the bloodstream and enters the interstitium, which is the extracellular fluid, and the tissues. So we have talked about absorption. Now we are going to talk about distribution. The drug has been absorbed in the body, but how will it be distributed in the body? And there are some factors which affect that. And they are: number 1, blood flow; number 2, capillary permeability; number 3, binding of drugs to plasma proteins and tissue; and number 4, lipophilicity. So I'm going to talk about all these factors in a little bit of detail. So first we are going to talk about blood flow. What is blood flow and how does it affect distribution? So blood flow is basically the rate at which the tissue capillaries absorb a particular drug within the body. So for instance, the absorption of a drug in a vessel-rich organ is greater as compared to a skeletal muscle. So if we talk about a particular vessel-rich organ, for example liver, then the absorption of drug would be much greater in the liver as compared to skeletal muscles. And also, high blood flow together with high lipophility, for example of propofol, permits rapid distribution of it into the CNS. So if I talk about a particular drug like propofol, then it is highly lipophilic. I'm going to talk about that in a minute. But since it is highly lipophilic and it permits the greater distribution or rapid distribution of it into the CNS. So what we need to understand regarding blood flow is that the greater the blood flow to a particular area, or the greater the amount of tissue capillaries to a particular area, the greater the amount of absorption or the distribution of that particular drug. If I move to the next slide, I'm going to talk about the capillary permeability. That capillary permeability also affects the distribution of drug to a particular region or a particular area of the body. So capillary permeability is basically determined by the capillary structure and also by the chemical nature of our drug. Capillary permeability varies in terms of the fraction of the basement membrane. So if we look at this picture here that we have of different capillaries, we can see that we have three types of capillaries. First we have the sinusoid capillaries, we have the fenestrated, and we have the continuous. So the sinusoid have the greatest amount of fenestrations or greatest amount of gaps in the basement membrane, and therefore they can absorb large amount of drugs and different type of proteins, different type of molecules within themselves as compared to the continuous or the fenestrated capillary. So the greater amount of capillary permeability, the greater amount of absorption of proteins or molecules of drug within that particular capillary, and therefore greater effect will be produced. So in the brain we have capillary structure that is continuous and there are no slit junctions. So mostly the sinusoid capillaries are located in the liver and spleen, and the continuous capillaries are located in the brain, and therefore the absorption in liver and spleen is much greater as compared to brain. So if I move to the next slide, I'm going to talk about the next factor which affects the distribution of drug, and it is basically the binding of drug to plasma proteins. So we have a few plasma proteins which are present within the body, and these plasma proteins have irreversible binding and they are present in non-diffusible form, and they also slow their transfer out of the vascular compartment. So we have a particular plasma protein which is albumin and is a major drug binding protein, and it also acts as a drug reservoir. So it is basically a plasma protein which binds to these drugs and transports these drugs to various parts of the body where they are needed, and therefore it is a major drug binding protein, and it also acts as a reservoir that it can store these drugs within the body or within the bloodstream or vascular compartment for a large period of time or a longer period of time, and therefore that particular drug might have larger effect or might have greater amount of effect or greater period of effect as compared to that have not bind to this particular protein. If I move to the next point, which is the last point of the drug distribution, it is the lipophility. So how does lipophilicity affect drug distribution? So lipophilicity basically means the chemical nature of a particular drug, how lipophilic it is. So lipophilic is basically a biologic characteristic which allows a particular drug to bypass or dissolve in the lipid membranes, and therefore they have greater effect within the cell, or they can penetrate the entire cell surface, and therefore lipophilic drugs have greater distribution as compared to non-lipophilic drugs. So lipophilic drugs readily move across biologic membranes, and these drugs dissolve in the lipid membrane and penetrate the entire cell surface. So for that matter, you can see here that a hydrophilic molecule will need to go through a particular transport or a particular channel, whereas a lipophilic molecule can be bypassed or can be transported readily via the lipid bilayer or the layer of the cell. So I hope you understand this concept, and now I'm going to move to the next topic, which is the drug metabolism. So what is drug metabolism? So we have talked about drug absorption, we have talked about drug distribution. Now we are going to talk about drug metabolism. And drug metabolism is essentially the metabolism of a particular drug within the body. And where it happens, there are major three routes of drug metabolism, and they are the hepatic route, the biliary route, and the urinary route. And the metabolism basically happens via these three routes or these three phases. And the lipid soluble drugs cannot be efficiently eliminated from the kidneys. Therefore, the lipid soluble drugs must be metabolized by the liver using two general set of. So we have two general set of reactions via we eliminate the lipid soluble drugs before they can be eliminated by the kidney, because the kidneys cannot eliminate them in their lipid soluble form. So first these two reactions or these two phases are taking place in the liver, and there they are metabolized to forms where they can be excreted readily by the kidneys. So the first of such reaction is the phase 1 reaction, and the second of such reaction is the phase 2 reaction. I'm going to talk about these reactions briefly in the next few slides. So first we have the phase 1 reaction. What is phase 1 reaction? So phase 1 reaction is essentially the reaction which converts the lipophilic drugs into more polar molecules. So as I told you guys before is that lipophilic drugs cannot be excreted by the kidneys readily. So they need to be converted to more polar molecules via the liver, and this process is taking place within the liver. There are some reactions that are involved during this process, and they are the reduction, the oxidation, and the hydrolysis reactions. And what is the protein or what is the system basically involved during these reactions? This is the cytochrome P450 system, and this is essentially a microsomal mixed function oxidase system, which is again also called the cytochrome P450 system, which is present within the liver, and it is responsible for the metabolism of many endogenous compounds and also for the biotransformation of exogenous compounds, essentially the drugs which we are talking about today. And it is what basically biotransforms the drugs from these lipophilic substances into more polar molecules. And this is essentially a long and lengthy process, but what I need you guys to understand is that these lipophilic drugs are being transferred or being converted into more polar molecules via different oxidation, reduction, and hydrolysis reaction. So this is what happens during the phase 1 reaction. And what happens during the phase 2 reactions? So during the phase 2 reaction, what happens is that there are a series of conjugation reactions. And what are conjugation reactions? Conjugation reactions are basically the type of reactions in which a metabolite from phase 1 metabolism, if it is not sufficiently polar. So sometimes what happens is that a drug is being metabolized and it is being converted from lipophilic to more polar molecules, but even after phase 1 reaction it might not be as polar or might not be as sufficiently polar as compared to other molecules, and it might not be readily available to be excreted by the kidneys, or kidneys might not be able to excrete them. So we have these reactions which are called conjugation reactions taking place again within the liver, and these reactions convert these substances using substrates like glucuronic acid, like sulfuric acid, like acetic acid, or sometimes amino acid, and they basically render these metabolites inactive, and they are therefore made more water soluble. And what happens is that these highly polar molecules conjugate and they may be excreted by bile or kidney. So again, what is happening is that even after phase 1 reaction, some drugs or some metabolites are not sufficiently polar, therefore they cannot be excreted by the kidneys, and in these phases, these molecules or these metabolites are further converted into more polar substances, and their metabolites are rendered inactive, and in that way they can be excreted by the kidneys. So I hope you understand this concept, and if I move to the next slide, I'm going to talk in a little bit more detail about these processes via this diagram or via this picture. And you can see that during the these lipophilic substances are being converted. For example, R represents our drug, and what is happening is that via the oxidation reaction, oxygen group is being added to these particular drugs, and then it is basically added to this particular drug. And also what is happening during the phase 1 reaction are the hydrolysis and the reduction reactions. And during the hydrolysis reaction, OH group is being added, and during the reduction process, NH2 group is being added to the particular metabolite or the particular drug. And this is essentially what is happening during the phase 1 reaction. And these lipophilic substances are being converted to more hypophilic substances. And what happens during the phase 2 reaction is that again, we have this particular metabolite or this particular polar molecule which is not sufficiently polar, and it is being converted to more sufficiently polar substances like the RSC, and more metabolites and more different groups are being added to that particular drug or particular molecule. Also in phase 2 reaction, sulfonation, acylation, and glucuronation reactions are being taking place, and eventually what they do is they convert these substances into more hydrophilic substances. So I hope you understand this concept, and if you still have queries, you can request for more videos like this, I will be happy to make more videos on this topic for you guys. So finally, we will talk about drug elimination. What is drug elimination? How does it occur? So after all these processes have taken place, the drug absorption process has taken place, drug distribution process has taken place, drug metabolism process has taken place, with the last process or the last factor that is happening to that drug is the drug elimination. So the drug is eliminated via a number of routes, and the most important route is the kidney or the urine. Other routes might be bile, intestine, or lungs. Drugs that have been made more water soluble in the liver are often readily excreted in the kidneys. But if there is any kidney dysfunction that can lead to toxic level of drugs in the body, then the drugs might not be excreted as readily as compared to someone who does not have kidney dysfunction. So if you look at this diagram also, you can see that there are different routes by which drug is being eliminated via saliva, via sweat, tears, skin, hair. Also milk and lungs can also excrete drugs, and also particularly by liver and kidney. So kidneys are the main organs which excrete drugs, and liver is the main organ which metabolizes these drugs. So I hope you like this video, and if you have any questions regarding this topic, or you want me to make a detailed video on any of the topics that I have explained to you guys, then please comment down below in the comment section. I will be happy to answer all your queries and questions. And again, if you want me to make future videos regarding these topics, please like, share and subscribe to Med Learning. Also hit the bell icon so that you will be notified about our future videos. With that said, thank you for watching this video, and I will see you in the next video. Bye bye.